ever since I got out of nursing school. I was not one of those people that spent time in med surg. I went right to NICU. I did my undergrad degree at Saginaw Valley. I did my master's degree at Stony Brook SUNY in New York because at the time I was looking to go back and get my NNP. They had the highest pass rate on boards in the country. Most of our faculty there at Stony Brook were actually writing the board exams for NCC. So it seemed like a good place to get my master's degree. And then I did my doctorate at University of Michigan. This program we've been talking about, honestly, since I've been at U of M. I joined the team there from St. Joe's Ann Arbor in 2017. Really sought a need for a different program in the state of Michigan that's a little more flexible. We currently have Wayne State is the only NMP program that's in the state of Michigan. And we have a lot of NICUs in Michigan and a lot of NICU nurses in Michigan. I currently teach at the University of Detroit. I am an associate professor there, and I teach PEDS, OB, and nursing research. I did kind of co-teach some classes at Wayne State in their neonatal nurse practitioner program. And then about a year ago, started speaking with the dean at University of Michigan Flint, along with my leadership team at Michigan Medicine, and came up with this great collaboration between Michigan Medicine and U of M Flint to bring this to where we are today. So we've got a couple of things on our agenda today. I want to talk a little bit about our journey, where we are currently and where we're headed and what we are in the process of building. I want to kind of give you some information about key factors in choosing a high quality graduate program, because I know this is not the only program out there that you could do online. I am going to give you some reasons why I think this is the best one for you to consider, though. We're going to talk a little bit about why become a neonatal nurse practitioner. It's definitely an evolving role with responsibilities and expectations. We're going to talk a little bit about the NMP job market, current trends, future outlook. I want to talk about our program overview. We're going to give you the first sneak peek at what the courses are going to look like and how they're laid out and what opportunities and options you have between full and part-time. And then we'll kind of briefly touch on your next steps, application process and timeline, staying connected, how you can stay connected with us as we're working through this process. This program is launching fall of 2025. And then we're going to save some time at the end to make sure you can ask some questions. Hopefully I have the answers. If I don't have the answers, some of our other U of M folks on here may have the answers. And if not, we will be sure to get those answers to you after the fact. So why U of M Flint? U of M Flint has CCNE accreditation, and we are going to talk about why accreditation is important when you're trying to figure out where you want to spend both your time, energy, and your dollars in looking at next level education in nursing. There are graduate nursing certificate options within U of M Flint, so you have lots of other opportunities when you get this degree to kind of add some things onto that. There are some service learning opportunities. We have personalized course plans, and we have faculty that still practice in the field. For those of you that are working at Michigan Medicine, you might recognize Monica Bishop here. She is a University of Michigan grad, got her nursing degree from there, and she is one of our absolute best neonatal nurse practitioners. So she is really a good proponent of programming at U of M Flint. So where we are and where we're headed. So the program is swiftly moving through the university's approval processes. Getting a new program through any university, just not University of Michigan Flint, takes a lot of steps. We have to come up with a plan for curriculum, and then the curriculum has to kind of get tweaked, and wording for course report or course descriptions, and then it goes through committees, and then it needs to get passed through the graduate team, and then it needs to get passed through the School of Nursing, and then it continues to work its way through approval processes through the university all the way to the end until it gets kind of blessed and approved by the provost. And that is when we can actually take this program live, start accepting applications, and really start broadly marketing it. So we are probably 7/8 of the way through the approval processes. Our courses are currently getting uploaded into the catalog. So we have got the wording set, we've got the credit set, we've got a plan for everything. All the classes have objectives, all the classes have textbooks assigned. So we're just waiting for those final two kind of committee blessings to be able to kind of blast this out to a wider audience. We are in the process of getting application approval to both CCNE and NCC. NCC is the organization that you will take your NMP nursing boards through. So they are the ones that also manage the continuing education, and to have a program that is eligible to be able to sit for those board exams, we need to get it approved through CCNE and NCC. Both of these applications are done. They're currently under review. We're kind of working our way through some of the verbiage and wording of it, and those will be ready for submission, so that when we have students that graduate from this program, you will be graduating from a program that's both CCNE and NCC approved and sanctioned. We are spreading the word now through a lot of our internal channels why we are anticipating final approvals. We were hoping to get approved all the way through the end of the approval process here at U of M-Flint by the end of January, early February, and we are on track for that. So you all are going to be the first ones to really see this. Once it's approved, like I said, we are going to begin marketing the program a little more vigorously throughout the region, starting in Michigan and then expanding through the Midwest as we look to build our very first cohort of students getting ready to start with us in fall of 2025. So what kind of things should you be looking for in a high quality graduate nursing program? All of you are here with us today because you're interested in learning more, doing more, and maybe taking on some new challenges in a new role. Maybe you've been a NICU nurse for a long time and you're like, I just really feel like I need to learn something new. Maybe you have a great nurse practitioner you work alongside and you want to kind of emulate what they've done with their career and kind of had a broader impact. There's a lot of reasons people decide to go back to graduate school. One of the first things you want to make sure you're doing, I would encourage you to look at other programs and make comparisons so that you know at the end of the day, you are spending your time, your energy, your blood, your sweat, and your money on a program that's going to deliver exactly what you need. So look for accreditation. You want to make sure that your program is going to be CCNE or ACEN accredited because those organizations hold nursing programs to rigorous academic standards, and that is what you want. You want high graduation rates. You want people to have jobs when they graduate, and you want a very high board certification pass rate at the end of the day. You want curriculum that is going to be specialized to what you need to learn about. You want curriculum that's going to be able to balance theory and practice. And you want curriculum that's going to really speak to you as adult learners, which is what this program is going to be able to deliver. This program is very heavily based in clinical experiences, and I'm sure that does not come as a surprise to any of you that are in the NICU, is there's a lot of skills we need to be able to do as NMPs. We need to be able to navigate through complex patient care right from the beginning. We always don't know what we're walking into, so we want to make sure as an academic program that we give you robust clinical experiences so that you feel confident on day one to jump into practice. NAP and NAN both have program suggestions and guidelines on what new NMP programs should be offering and how those programs should be laid out. And we took those to heart and developed our program alongside some of the best recommendations from programs across the country, what works for them, what doesn't work for them. So we are going to have very diverse, robust clinical experiences in reputable healthcare settings. So like I said, when you graduate from this program, you are going to feel confident and energetic to be able to jump into practice on day one. You want to be able to attend a program that has faculty expertise. You want experienced, credentialed faculty that have both clinical and research experience that they're willing to share. You also want faculty that are approachable and accessible and are able to be reached and are able to talk you through any of the challenges maybe you're experiencing in your graduate program. Our program will be small, it will be personalized, and you will have that one-on-one personalized touch as a student of this program. You want flexibility. You all are busy working nurses in NICUs, dealing with families and personal lives and hobbies and things you want to do to enrich your lives. In school, because you're here on this call, is certainly something that is a focus for you. but it should be able to fit into your existing life. And this program is going to be online. You're going to have a couple days that you're going to have to be with us on campus so that we can practice skills and make sure that you know how to put in lines and you know how to intubate and you know how to do chest tubes on a baby. We're going to work through some case studies. We're going to practice some resuscitations with you being head of the bed. But you are going to have those 6 dates. It is a total of 6 dates. There's 2 and 3 separate semesters. And you will have those dates before you actually apply. So you'll know exactly what we're looking for. Currently working on getting those dates set, and I'm looking at them being sequential. So maybe it would be a Monday, Tuesday, Thursday, Friday in one semester, and then the following semester it would be something similar back to back. So it'd be easier for you to be able to schedule and factor in to your life. Like I said, these on-campus days are going to be very much manageable. They're going to be 2 8-hour days. They're going to be very focused on hands-on, skill-based. Here's how we put in lines. Here's what we look for. Here's what we do when things don't work the right way. How do we troubleshoot? How do we suture? All those hands-on things that you see your nurse practitioners doing in your units. We want to make sure we're giving you a lot of guided practice before you're expected to be able to do all those things in clinicals with your preceptors. We have a lot of support services, which is what you should be looking for in a graduate program. So high quality programs are going to offer strong support. They should include academic advising, career counseling, mental health resources, and tutoring. And those are all things that UM-Flint are going to be able to offer you as a student of the program. Certification prep. So I put on here neonatal certification. It comes through NCC. We are following the NCC blueprint for both content that needs to be taught in an NMP program, because it is content that you will be tested on at the end of your NMP program. I've been in contact with a whole team of people at NCC. We looked at all of the things they expect new graduate NMPs to be able to do, and we built every single one of those components into the program in a sequential way so that everything that they are going to test you on is added into the core curriculum of this program in the didactic classes. They also offer some specialty practice exams. So in working out what that looks like for us, I'm hoping to be able to pull some of those practice modules into our last semester before you would be taking your board exam, so that we can get you some practice questions that make you feel very confident about your knowledge base. We've also talked about doing a review session with our students to make sure that you feel like you're set up for success before you would sit for those board exams. Cost and aid, you should be reviewing tuition and fees. Certainly, it's a big commitment for everybody going back to school, as well as options for financial aid, scholarships, loan forgiveness programs like the Nurse Corps loan repayment program. Many of the hospitals that you are working in will also offer some version of tuition reimbursement. And there are a lot of opportunities for NMPs to be able to negotiate with their employer, especially if your employer is looking to hire a big group of NMPs to be able to meet staffing needs. A lot of hospitals sometimes occasionally will offer to pay for tuition, offer to pay your full-time salary, but give you 1 day off a week to be able to go to school. So if you are currently working in a unit that you know is a little bit underwater with staffing and has a background of paying for people to go to school to help kind of fill in those holes, that might be a good conversation to have. Career opportunities, having a strong alumni network can provide valuable connections and membership opportunities. As a graduate of University of Michigan Flint, you would have that strong alumni network. And then looking at interdisciplinary and leadership opportunities. So you want to look for programs that are going to emphasize collaboration with other healthcare disciplines. I cannot think of a better collaboration to build a NMP career on as having one between Michigan Medicine and University of Michigan Flint. It is very much a new idea that we came up with. We're the very first program to be able to collaborate with Michigan Medicine like this. So I feel like we have a lot to offer, and there's a lot of resources put behind having this program be successful. Even things like offering leadership training, preparing you for advanced practice, those type of things should be involved in any graduate program you're looking at. So you're here because some part of you is interested in being a neonatal nurse practitioner. So what does that actually mean? At a minimum, you're going to be a master's prepared advanced practice nurse, nationally certified to care for patients in an acute setting, birth to 2 years old. So our credentialing and our licenses take us to 2 years old. Job responsibilities, things we're going to make sure you are ready for as you graduate from this program, direct care management of patients in a neonatal ICU. We are going to give you experience in attending deliveries, and I'll talk about that when I pull up what the curriculum looks like. So attendance at deliveries, stabilization of well newborns also falls within our role and responsibilities. Patient resuscitation with management at high-risk deliveries. If you are working in a place that does transport, NMPs tend to be the folks that are on those high-risk transports. So air and ambulance transport, how to stabilize babies when you're off-site. Oversight and training. We are responsible for training not only new NMPs and taking students, but we also help manage with residents and fellows and specialists that come and spend time with us to see what we do and how we do it and learn kind of the background of our complex patients population. You are going to be credentialed at a minimum for intubation, how to give surfactant, how to manage ventilators, how to do a needle aspiration, how to put in a chest tube properly, how to place umbilical lines, PICC lines, arterial lines, how to do bladder taps, reservoir taps, lumbar punctures, and many of us are also credentialed in moderate sedation. So those are all things we're not only going to make sure you have experience with in our hands-on session days, but we are also going to make sure that you're getting those opportunities in your clinical experiences so that you feel very confident and comfortable doing those procedures. We also coordinate with developmental assessment clinics. Sometimes, depending on where you're working, developmental assessment clinics sometimes are staffed by NMPs up through 2 years of age. And then we do a lot of coordination with primary care and specialty care providers. Oops, how did I go backwards? There we go. So what does that job market look like? So NMPs take up about 1% of all the national nurse practitioners currently out there in practice. So we're a small subset of the advanced practice group out there. Historically, the supply of NMPs has rarely met the demand for services, and we know that to be true. Many of us are working in places that are understaffed, where we've had to use, some fill-in hospitalists and those kind of things to manage the work of the NMP. Needs vary by region at any given time. I will tell you there are a couple hot regions in the US that are always looking for NMPs and offering huge sign-on bonuses. Texas, Arizona, Colorado right now is currently offering a lot of big sign-on bonuses. There's a couple out east, a couple in Florida, but by and large, the recruiters I get calls from that are offering $40,000, $50,000 sign-on bonuses with moving expenses tend to be more out west, where the population is increasing, the number of NICU beds needs to increase, so the number of NMPs need to be able to increase. On a survey, 85% of hospital administrators report current or expected vacancies in NMP positions with no existing plan in place as to where to find these NMPs. So hospital admins know that they need to hire more, but they are not sure where they're going to get them from. If you are working in one of those hospitals, that is great leverage to, how about you pay to send me to school and I will be here for 3 years after I graduate and work as an NMP, and pay you back by giving you my time and energy. Residency hour requirements, and I'm guessing many of you on this call are aware of this, but in July of 2025, the residents are not going to have the same hour requirements to spend in NICU. So any NICU that is in a teaching institution in the country is going to have a gap in coverage in their NICUs. The residents are no longer going to be doing a couple rotations through the NICU. They are going to be doing one and spending more time in primary care. So what that's going to do, it is going to increase huge vacancies in staffing and covering units that are utilizing residents to cover patients. And that is going to exponentially increase the demand for more NMPs, which is also going to exponentially drive the salary cost for NMPs. I'm guessing in the next year, we are going to see a huge influx of not only more NMP positions, and there's already a lot out there, but we are also going to see a big increase in sign-on bonuses and salary increases and efforts to make schedules more in alignment with work-life balance to draw people to their hospitals, to be able to kind of piecemeal that gap that the residents are going to leave starting in July. We know this is going to affect every single NICU and special care unit in the country, and most people do not have a plan for it. The job market for NMPs is already brisk, and it's going to get really substantially brisker across the country. The estimate is 15 jobs available for every graduating NMP. And depending on where you want to live and what kind of NMP you want to be, there's a job out there for you. If you want to do special care nursery, it's there. If you want to do level 3, level 4, it's there. If you only want a transport job as an NMP, it's there. We have one of our NMPs in our unit right now that moonlights in Nebraska, and that's all she does is go out there and do transports. Average starting salary as a new NMP graduate is on average about 129 to 168,000 starting. That doesn't include sign-on bonuses. That also doesn't include differentials. So making the profession very desirable for nurses interested in advanced practice within this population. We are second only to CRNAs. And I would venture to guess the CRNAs get paid at a higher rate than we do because they're able to bill for our services, whereas our services in the NICU tend to get bundled into the room charges. So some of the curricular specifics that we looked at when we were building this program. So program development was 100% done according to the Commission on Collegiate Nursing, so CCNE, which we talked about, as well as the National Task Force for Quality Nurse Practitioner Education. And the National Neonatal Specific Certifying Bodies. The two neonatal certifying bodies we looked at, the NCC and the NAN and NAP. The National Association of Neonatal Nurses and Nurse Practitioners in 2023 updated educational standards. They also put out a very prescriptive curriculum guide for upstarting neonatal nurse practitioner programs. And this program very much took that to heart and was built upon those required standards. When we look at how we're going to measure student outcomes really are going to be measured through rigorous examination that's going to be in line with the national credentialing standards. We expect our students who are graduating from this to hit the 100% pass mark. Every other program at UM-Flint has a 100% pass mark for their board exams, and this program is going to be exactly right in line with that. Like, that is the expectation we're setting. That's the expectation we're holding for ourselves. And that is the expectation we're holding for the people that graduate from our program. So we are going to be there to make sure that you feel confident and are 100% prepared to sit for that board exam and pass it with a 1 and done. Looking at the program overview, so this is going to be a flexible, fully online format. Online formatting to me does not mean that we all sit on the computer at 5 p.m. and listen to somebody lecture. Online format to me means that there are educational resources and content posted for you according to the syllabi, according to the week, according to the course layout, and you can access it when it makes sense to you. If you are working night shift, you do not want to have to log into a class at 5 p.m. If you're working day shift, you're not going to be able to log into a class at 5 p.m. This is going to be 100% flexible for you in your world. If you are super busy with kids and family Monday through Friday, but you know your weekends, you have loads of time, you are going to be able to do it entirely online with minimal on-campus requirements so that you can make this program flex and fit into your life as it should. I had already mentioned the on-campus engagement. There are going to be 6 required on-campus days. As of right now, we are going to do those at Michigan Medicine because we are going to do them in their simulation lab. I have tentative dates kind of set. I'm just waiting for them to confirm that we can get in to all the neonatal equipment and supplies we need on those days. So I should have those available in the next couple weeks. They're going to be scheduled as 2 consecutive days over 3 semesters. So a total of 6 days. And like I said, you will have those 6 dates 100% in your hands before you apply so that you can kind of work your schedules around them. There are flexible tracks that are going to be able to fit your lifestyle. This is a BSN to DNP program. That means at the end of this, we are hoping everybody on this call applies, is in our first cohort, and is geared to get your DNP. However, there is an option in this program where you can step out after you complete the courses for your master's degree, take your boards, work for a while, and then come back to us and finish your DNP in 2 more semesters. Or you can go straight through. Part-time track is exactly laid out the same way as a full-time track, except it's going to take 2 more semesters to get your master's and 3 more semesters to get your DNP, because we didn't want to overload too many semesters with credit, so we spread it out a little bit farther. Credits required, there are going to be 54 credits to earn your master's degree with the neonatal track, a total of 69 credits to earn your doctorate degree. There are 28 NMP specific credits that are going to be spread across 11 courses. In the clinical hours, there are 780 neonatal clinical hours for hands-on experiences. I don't know how many of you follow graduate education, but the guidelines just changed recently as to the number of clinical hours that are tied to each credit. So if you have a credit, how many clinical hours does that need to be? And we are exactly where we need to be with that. So even if they move the goalpost a little bit, we're not going to have to add everything on because we've got everything already kind of topped off to where the guidelines recommended it be. So what's going to set this program apart? We're going to have flexible and manageable learning. People do not learn from having somebody sit on a computer and lecture to them. Research shows that adult learners tune out lecturing at the 15-minute mark. So our plan is to have engaging online instruction that's designed to fit seamlessly into your schedule, empowering you to balance education with both your personal and professional life outside of school. We understand what adult learners need to be able to learn all this new information. This program is going to embrace innovative teaching methods tailored to how all of you are going to learn. We need to have active engagement. There needs to be practical application and real world scenarios. Listening to me lecture for 3 hours at a time about the pathophysiology, about the renin-angiotensin system is not going to keep everybody awake and or engaged. So we are going to do a lot of real world scenarios and a lot of what do you think about this and what are you seeing when this happens? Videos, we're going to have a lot of guest lecturers. People at the top of their field are going to come in and talk about hematology and cardiology and those type of things. This approach is going to ensure that you learn by doing and not just listening. My goal for this program is to not have a standardized, here's my PowerPoint slides, lecture longer than 30 minutes, because honestly, adult-centered learning shows you that nobody is listening past the first 15. So we're going to try and keep it very much engaged, very much some mental health support. So our curriculum is going to include a specialized mental health course to prepare you as a compassionate provider. We want to be able to equip you with the tools to address all the complex emotional needs of these patients and families. And I feel like our families are just getting more and more complex, and the work situations can get a little more complicated than they used to be. And we want to make sure we're not only giving you the tools to support yourself, but to give you the tools to support the moms and the dads and the family members and your coworkers who are maybe having some bad stuff happen during their day at work. And we felt like that was very important. So we made sure we prioritize that in building out the curriculum. And then you're going to have some comprehensive clinical experiences. We want you to be able to gain hands-on experience across a lot of different settings. Neonatal nurse practitioners just don't need to know what's happening just in the NICU. So we want to make sure we're giving you some exposure to high-risk OB, well baby care, well baby transitioning, labor and delivery, putting you in high-risk triage so that you can learn about monitoring and some of the verbiage that our OB colleagues are using. Put you with a neonatal consult team so that you can see what actually happens behind the scenes. When we said we did a neonatal consult on a mom that's 23 weeks and coming in contracting, and we know the baby has anomalies, and what does that look like as a provider doing that consult, and how to get good at those consults. We for sure are going to have you spending the bulk of your time in the NICU because that's where you need to be. But we also want to be able to rotate you through, pediatric cardiothoracic ICUs and PICUs, where a lot of our graduates end up going. Anything under the age of 2 is fair game. So learning how our babies transition in those other units is just going to make you a better, well-rounded NMP. And hopefully it's going to create a very impactful educational journey for you. So this is what the curriculum looks like, and let's walk through it a little bit each semester, and then I've got the part-time one next. So I broke this down into advanced practice provider classes. So you have a series of classes that fits into your master's degree that are specific to everybody at U of M-Flint. Everybody takes the patho, everybody takes the pharm, everybody's taking healthcare research, everybody's taking biostats. So those courses are all on the top. The neonatal specific ones are listed on the bottom. So you are going to have neonatal embryology and foundational neonatal pathophysiology. You are going to learn more global pathophys from this NCS course at the top. But this neonatal class is really going to speak to you about fetal development, body system development. Why do we get kids that have anomalies? What does that look like? So you're going to have a great foundation from that prior class. And then this is going to really tailor it to the population you're interested in. We are going to have an advanced health assessment of the neonate and the infant. This second semester is going to be the first time you're going to be on campus for 2 days. We are going to talk head to toe assessments. What do we look for? What are the right words that we call things when we see things that aren't quite what we expect them to be? What are some of the tools we can do to assess our children, the babies, even more in depth? What is that going to look like? How do we document it? How do we note it? How to start stepping into professional advanced practice and what that looks like and how that is different from what you're doing as a nurse. So all those concepts are going to be covered in those 2 days we're going to spend together. And then you are going to have advanced health assessment of the neonate and the infant practicum. 1 credit equals 60 hours of clinical time. So looking at most people are probably going to be interested in doing 12-hour shifts. So you essentially, this second semester, you're going to do 5 shifts. Those 5 shifts are going to be focused on well newborn transition, how to do a well newborn exam. What does that look like? And then this is also the semester we're hopefully going to get you in for some time in triage, some time with high risk OB, so that you're able to see what happens to our babies before we actually get them. There is a real science and practice to transitioning newborns once they're delivered successfully. And so spending some time with those providers and really learning, what does every baby need to have CPAP? If we leave them alone, are they going to breathe okay on their own anyway? And then special topics in neonatal pharmacology. Again, you are going to have a great foundation for pharmacology up at the top on that first semester with the pharm class. But this 2 credit special topics class is going to really drill down all those concepts that you need to understand and apply it to a neonatal population. I feel like a lot of the students we get from a variety of programs, probably their weakest knowledge base is going to be in patho and pharm. And honestly, those are the 2 things that need to be the strongest. So the way this program is developed is you're going to get a great general education on patho and pharm, but then we're really going to hit home what pharmacology and pathophysiology and embryology looks like in the neonatal population. Moving to the summer. So this is the summer that you are going to learn how to do all the skills. And this is usually the stuff that NMP students really find the most exciting because it feels very advanced practice when you learn to do intubations and, central lines and chest tubes and bladder taps and VP shunt taps and all those types of things. So we're also going to learn radiology diagnostics. So going through a lot of x-rays and ultrasounds and MRIs and what do they look like and what should I be looking for? So on this on-campus experience during this 3rd semester, we are going to practice skills. Everybody is going to be very adept at skills by the end of these 2 days. And we're going to spend some time together going through x-rays and what does this mean and what should I be concerned about, so that you feel very confident being the first preliminary interpreter of the radiology. Then you're going to have your first clinical course. So we are going to have neonatal clinical management and advanced practice role transition. And then that is going to be very much tied to practicum. So we're going to talk about, babies that are transitioning, CPAP babies, diabetic babies that we're managing glucoses, stable kids so that you can get really good at the stable babies so that the next semester we can start adding on vents and lines and those type of things. So you're going to have clinical during this 3rd semester. It is a 4 credit practicum class. So about 20 shifts of clinical would be expected to get those 240 hours in. we're making the assumption that most people are going to prefer doing clinicals in 12-hour blocks. Looking for the other class that we have in the summer, this is also where we embedded the mental health class. And like I said, I feel like this is going to set this program apart. All of you working in neonatology understand the stresses. You understand the complexity of the patients, the complexity of the families, what happens when things don't go correctly, what happens when things do go correctly, and maybe they shouldn't have, when we're looking at resuscitation timelines, babies, those type of things. Working with colleagues that are working in high stress situations, working, being able to find your peace in the middle of a crazy day. So we elected to include this psychiatric mental health concerns in theory. It sounds a lot more practice-based than it is, but you're going to get a lot of added knowledge on how to have difficult conversations, both with colleagues and with families. How to protect your own mental health. The syllabus for this class is exactly what we need to be able to grow out neonatal nurse practitioners that have the tools available to manage some of those challenges we see in our units. And we felt like this 3-credit class was a fabulous addition to be able to accomplish that. Moving to your second to last semester, so it goes pretty fast. You have got another neonatal clinical management and illness 1 class. This is where we're going to start introducing kids with Lyme, stabilizing sick kids, kids on ventilators, post-op kids, pre-op kids, those kind of things. You'll have the same amount of clinical hours, 240, about 20 shifts. And then moving to the winter semester, this is going to be your final semester if you decide to step out for a while, but this is where your MSN will be conferred. Conferred means you will be granted an MSN and would be able to sit for your boards. So you're going to have your advanced neonatal clinical management illness. This is where you're going to be taking care of 23-weekers, trauma kids, kids that are coming in that are super complex with your practicum class. Again, 240 hours, about 20 shifts. If you choose to keep going, you've got 2 more semesters, and then you will have your doctorate degree. So the last 2 semesters really look at, building your project, kind of finalizing your education and moving out from there. Our part-time program is set up exactly the same way, except we spread it out over more semesters. The neonatal classes are actually in the same order of the same semester because we are very committed to building a community of neonatal care providers within this program that can rely on each other and build off each other's knowledge base. So we very purposefully and intentionally slotted these classes in this part-time course load in so that it actually aligns when the full-time students will be here. So it wouldn't just be part-time students, it would be part-time students and full-time students who are taking, for example, the health assessment class in the winter semester here. You would be there together so that you can network, you can build with each other, you can have more resources and build more support for yourself and not feel like it's isolating at all. So that's the part-time curriculum. So what are your next steps? So the next step would be application process and timeline. As soon as the program kind of clears that final university hurdle, we will be opening the application process. The application process is going to be the same application process every other graduate program uses at UM-Flint, with the exception of we are requiring 2 years of level 3 or level 4 experience in the last 5 years. That just needs to be listed on your resume to be considered. So the application process is the same. There's going to be supplement things you're going to add on. We're using the same website. We're getting everything pulled together. The only difference is that we want to make sure your CV or resume demonstrates that you've been in a level 3 or level 4 NICU for at least 2 years. That is a guideline that is recommended by NAN and NAP. It is very hard to be a neonatal advanced practice provider if you're straight out of nursing school and have only been in the NICU for a couple of months. NMPs need to be head of the bed in dictating the care, and depending on where you practice at, you may or may not have oversight. There are plenty of NICUs in our area that you don't have attendings in-house overnight, or you don't have fellows in-house overnight. And the buck stops with you. And really, to build on the knowledge base, you need to have some level of comfortability in a NICU. And NAN and NAP really said that really needs to be at 2 years. So we benchmarked a lot of other programs across, actually, we benchmark all 36 programs across the US. And this is really in line with what the top level programs are doing. So we set that standard for 2+ years. And then everything else is kind of following similarly from there. So staying connected. So how to build your network and resources. So we very much encourage you to stay connected and reach out to us with any questions about the program. And we'll have about 15-20 minutes to be able to answer questions because this is my last slide here. As an online program, we are very much dedicated to fostering students who can build cohorts and create meaningful change in the neonatal field. We really want to build a strong community of students and future graduates to lead this next generation of neonatal care providers. We are excited about this program. We are very much excited that this program is the first of its kind in a collaborative program between University of Michigan-Flint and Michigan Medicine. Our team really is here to support you every step of the way, from questions to should I apply, to I'm nervous, to what if I can't do it. We are here to be your biggest cheerleaders. Please don't hesitate to contact us for guidance, clarification, any additional information. We are very excited to help you and provide you with any information you need. And I think the best thing of all this is we can say go blue ×2, because this is really a collaborative program that Michigan Medicine and U of M-Flint worked really hard to bring to fruition. My email is on there. I'm on my email all the time. I'm happy to have you email with any offline questions, or if you didn't get your question answered today, feel free to shoot me a message. Or if you just have a question, or like I said, you just need some encouragement to be able to take that next step, happy to navigate those for you. But now, why don't we open it for some questions? Because I'm sure there's got to be some out there.
Yeah, thank you, everyone. I know that was a lot of information, but hopefully you got some tidbits out of there that have maybe even stroked your mind about, the program, the process, tuition fees, how it's going to unfold for you. And as Michelle said, even, how is this going to work in my lifestyle? Is this really feasible for me? Please don't hesitate to unmute yourself and just reach out. A couple of us advisors are on here.
Hi, I'm curious about what full-time would look like if you already work full-time and if you have little ones home with you, or just kind of like what that's like, if it's actually feasible to go full-time as a busy parent and nurse.
Yeah, that's a great question. I think that's probably on the minds of a lot more of the people on this call than just yours, because I think when you're looking at going back to grad school, that's one of the things you have to navigate. Kristen, I know you and I had talked at work, and I did the same thing. I had 4 little kids and decided to take the leap. I went to Stony Brook, New York, and I've been an NMP for a while, and my program was online. So this whole, well, should graduate programming be online? I did a completely online program that had similar, where I had to be on campus a couple days for skills and those kind of things, and was able to navigate it. I was blessed with kids that actually had a set bedtime. I'm not sure how that happened, but I would do a lot of my school stuff when they would go to bed at 8 o'clock at night. I would log in, do my lectures, those type of things, was able to make it work. Fitting in clinical time can sometimes be a little bit harder when you're working full time. We're hoping anybody that wants to do clinicals in the place that they are working in, we can certainly navigate that, because then that takes out a little bit of an added stressor of having to learn a new system and having to drive across the state for a different hospital, or having to learn where things are. So that should take a lot of that newness off of, trying to figure out where you're going to do clinicals at. One of the things you could also do is start full time. And if you feel like it's not really fitting in, or you're not getting the work-life school balance that you're looking for, people could certainly drop down at that point too. And likewise, you could start part-time and then ramp back up and get those classes full-time. I think the benefit of having everything not be timed, like even things like exams and those type of things, you're going to be able to fit them into your timeline. I'm in the process of getting all the classes developed right now and coming up with the assignments. And my plan is, when you have something assigned, you're going to have an entire week to get it done before you have to get it submitted. So if there's an exam in pathophys, for example, you're going to have like a Sunday to a Sunday night to be able to get that hour and a half in somewhere where you can sit down and take the exam. Our goal is to make it hugely flexible, because we know by requiring everybody to have 2 years NICU experience, you all are working nurses and you all are looking to take that next step. So our goal really is to have this fit into your life is really as best as it can. And anything we can do on our end to make that happen, we will work on. Great question. Anybody else have questions? Anybody have questions about the classes or the layout?
I had a question about like instructors. Would you be one of our instructors, and like
Yes.
Marlena as well?
Yes.
And okay, anyone
Yep.
else that I know?
We haven't gotten that far yet, because in the beginning, we're only going to have a couple classes, but the dean and I have already sat down and talked about what does a full complement of faculty look like in the neonatal program? How many people do we need on board for that? So I think we've got a pretty good plan on, and I don't want to commit to something I don't have the power to commit to, but I'm fairly certain the 3 faculty we're looking at are all going to be people from Michigan Medicine, because of the collaborative environment and the fact that we really have committed to having this be a joint venture between UM-Flint and Michigan Medicine.
Okay.
Another great question.
And Kristen, you're going to make a great nurse, because I don't know how you're managing a toddler in the middle of a meeting and he's actually like engaging with us. So this is great.
Any other questions on courses or layout or what to expect? I already have the textbook list done. So when you get admitted to the program, you're going to know exactly what the textbook requirements are all the way through. Not that you need to purchase them all at the same time, but you'll have a great kind of snapshot of every book that you need for everything through. And we spent a lot of time vetting the textbooks we're using through our neonatal faculty and our fellows and our residents, and really having the textbook company send us a lot of options and really picking and choosing. So the textbooks we already have kind of picked. I should have the dates for the on-campus things. I just had to submit another educational plan to our simulation center at Michigan Medicine for the on-campus dates. And so that hopefully should be decided soon. But I think doing the days concurrently would probably be easier than people having to get multiple week with a day off in there. So we're going to try that and see how that goes.
And Michelle, we had a question from Amber in the chat. So how do clinical placements work? Is the student responsible for finding placement?
Absolutely not. That is something that students should not have to navigate. I will tell you, as we start moving and as this program gets rolling, we are looking to have it go more nationally. So if we have a student, say from Montana, I am hoping that they are going to be able to give us some direction. And if students are coming to us from Montana, my assumption is it's because they want to work as an NMP in their unit in Montana, and it's just to their benefit to do their clinicals in their home unit. But no, I would not have you come into the program and have me tell you, well, you need to tell me where you want to be clinicals, and then you need to get the legal stuff taken care of. We are going to handle all that, and we're going to have somebody that's going to be doing all the clinical coordination, navigation. One of the things I didn't put it on here yet because I don't really have anything concrete to show for it yet, but we're also building a preceptor class. We don't want our preceptors to not understand how to precept and not understand how to give feedback. I think it doesn't do us any good to teach you guys with the best intentions and the best innovation for adult learners and then toss you loose into clinicals and just hope that whoever you got assigned to for clinicals that day actually knows what they're doing and actually can teach what they're doing, which always isn't a great assumption. So we're in the process, and I've been very much in communication with the dean, who's 100% on board with this, is vetting our preceptors and making our preceptors also take a course related to how to be a good preceptor. What does precepting mean? You know, it doesn't mean you tell somebody they're doing great when they're not. It doesn't mean that you make them feel bad when they don't understand what they're doing. They're student learners. So making sure our preceptors, no matter where you're at for your clinical site, are going to be vetted by us and providing the best precepting that they can give, because we've had them take a bunch of modules and got certified to be a preceptor, so that we feel confident in their ability to be able to navigate your clinical education, because that's a huge part of it. And if you love your classes and hate your clinical experience, we're not doing anybody any good. So we want to make sure we've got both those things in lockstep. Great question.
Another chat question from Emily Miller. Is there a summer break, like a spring break week off, so we try vacation or something while our kids are off school?
Great question. So we would follow the university calendar. So whatever U of M-Flint's academic calendar is for the year that you would be in school, we would follow. So there is a winter break and there is a spring break. And you guys from U of M-Flint, are there any other breaks we have in there?
I'm looking it up right now, so give me a minute.
Yeah,
So
usually we have our, I guess you can call our winter, spring, our spring break late February, early March. Then our university officially semester closes around late April. So there's some time in between. But because you are doing online classes, it is a little bit different. Austin has just sent a link in the chat with the calendar, so you can look and see what those dates look like. But I will say, I'm a U of M grad myself. I graduated in 2010. A lot of people here on there are too. And I'm a working mom, and I will say the calendar really, it's okay. It aligns really well with a lot of, at least the public schools in Michigan that I'm aware of. And so it's not really been a, at least as a working mother, of course, you will be going to school, but it's the same schedule. When we're off, when we have a break, there's no classes. So yeah, take a look at that. Take a look at that calendar, and you can look at our schedule.
perfect. And I know there are summer sessions that we have factored into the full-time and part-time. I had kids, I went to school, I worked. I am not somebody that would make somebody have exams or having to be on campus like 4th of July week, those type of things. I think as we're building calendars and assignments and what is due when, I think there is a lot of flexibility to make sure that you can still have a life outside of school and work, so that you can fit in personal things too. When we were looking at dates for things, I'm trying to be very cautious about where to place those dates, because I know, start of school and those type of things with kids. So trying to work around those things so that those dates will get you some flexibility and not be like, why did she schedule this the week of 4th of July? Nobody wants to be here then. Like, that's just kind of silly. So trying to be very thoughtful about where we're picking those 6 required on-campus dates, and even assignments as we go through. As a faculty member at University of Detroit, I always try and make sure I'm scheduling things around things that are going to be important to students.
I have a quick question with like clinicals and classes. So I work full-time at Mott, and then I'm contingent as well at Henry Ford.
Yeah.
Is this something where we could like work our clinicals around like me working like 4 days some weeks and like 3 the other, or what, like I have to drop my like per diem job to like
No, not at all. My the way we typically do clinicals is you would get partnered with a preceptor, and then you and the preceptor would just figure out what dates work for you, and you would have an entire semester to get all those hours in. And so you may be able to get, if you do a Saturday, Sunday, you've already got 24 hours knocked off your list of things to do. So not prescribing. I would never assume that I can prescribe and schedule clinicals for students. It would just be you partnered with one preceptor, and then managing your schedule from there and whatever they're working, and sometimes it might be like, well, my preceptor's going off on maternity leave, or, they're on a medical leave right now. Like, we'll coordinate with whoever else. We get kind of credentialed to be a preceptor at that point. But trying to give you as much flexibility to get those hours in from the beginning of the semester to the very last day of the semester. You would have to get 20 shifts in for clinical, and those could be weekends. I think there's some benefit to doing some night shifts in there, because I feel like, at least at our place, we get a lot more hands-on skills in resuscitating a babies, because you're not fighting for all those things with all the people there. Getting some night shifts in, if that's something that's interesting to you, and you want to see what's different with the workflow on the night shift, because sometimes you get to do more hands-on stuff and get a little more autonomy. Great question.
Thank you.
I have a question.
Oh, sorry.
Kristen. I have a quick question about program start time. You say you're going to start fall of 2025. Are you going to do multiple starts like fall, spring, or?
Yeah, Laura, nice to hear from you.
Oh, great to see you.
Great question. So we talked about it, and since we are running it for the first time, we are just going to do single start dates.
Okay.
If we get a lot of interest and it feels like we have a lot of students and we can navigate all the clinical kind of components of all that, we had discussed down the road maybe doing a twice a year wind up start rate. But since this will be our first cohort, we were trying to keep it a little bit simple in running it through once and then kind of seeing where we're at with students and clinicals and those type of things. But that's a great question because we talked about it when we first started talking program design.
Right. Okay.
Yeah.
I had a question. Well, two questions. I don't know if you said it already, but did you specify an application due date yet, or to apply for the
Yeah, so
program?
we don't have the applications open yet. And we won't be able to open it until we get that final like little push through the approvals. You'll apply right through the online application process. We are going to take applications until we get that first cohort filled. I think my dogs are going to start barking, which is bad. So that is the plan. It's not like we're going to set applications need to be due by March 1st or April 1st. We are going to open them and encourage everybody to apply. If we end up with, 20 students for the first cohort, we would probably like try and figure out, like, can we push some people to the 2026, or maybe not everybody met the criteria, those type of things. But we don't have an end date. Since this is the first time we're getting this rolling, we were going to be kind of flexible on application dates.
Okay. And then I also wondered, like part of the application said letters of recommendation, and one of them said like from your BSN program. Was that what I was reading, or from a nursing professor? I just feel like it's been so long since I interacted with anyone.
Yeah, I took that right off the graduate page. Does anybody know how that works from like BSN stuff?
So what we do typically with letters of recommendation, it can be from any of the three categories.
Oh, okay.
Right. So if it's all faculty, great, which it's likely not because you have to have so much experience out there. But if it's from three, any combination in those three categories.
Okay. Thank you.
And that's
Thank you
Julie.
for that.
Julie is one of our advisors for the graduate programs for the School of Nursing. So one of the people you will be interfacing with. But as of right now, like we are still very much in the beginning
We're learning.
stages. We're learning right now as we talk, but we have all of your email and contact information right now. So as soon as we learn the information, as soon as applications are open, you guys will be receiving an email and any information regarding that.
How soon after applying would we be find out if we got it?
I am going to defer to advising again on that.
Well, that's kind of a tricky one. I don't know when we're reviewing applications. So I can't tell you how long. Typically our committee meets about quarterly. So with adding this program on and not having application deadlines, I can't exactly say. It all depends when they open the app.
Generally, Julie, is there a time frame though for decisions for graduate?
So it really depends on when we meet. So once we meet, we can have decisions out within probably a week of when we meet. But it all depends. So that's the best I can give. So if we don't meet till May 1st and we have everything in May 1st and we make decisions, we send those decisions to our graduate programs office. They have to process that. Sometimes that can take a few days for that, and then they'll send the notifications out.
Perfect. Thank you.
And we had another chat question from Emily. How large of a cohort are you planning on accepting?
So we are shooting for 15. We would be very happy if we can get to 15. 15 would be a great number to work through. Graduate programming tends to be not the same number as undergraduate programming across a lot of schools. So graduate programs like 15 would be a great full cohort, especially for our first time through. We really want to be able to give some personalized attention to our students as well. And that gives us a lot of opportunity to kind of help students through and navigate and make any updates or changes that maybe students can suggest as we're going through. So 15 is what we're shooting for.
Awesome. And we are at time. It's 1 o'clock EST. Does anyone have any final questions that they might want to ask advisors, staff, Dr. Whalen? All right, doesn't sound like it because you guys would have already chatted us or messaged. But we really want to thank you for meeting us today. I know you have a lot going on your calendars and schedule, but it shows that this is something you are invested in. Going to grad school is an investment, but it's an investment that will impact you, your community, your family for the long term. There's a lot of research on that. So with that said, Dr. Whalen, do you have any last words for our
No, but please reach out. Any questions? I've been in your position trying to figure out where to go, what my next step was going to be. I don't regret any part of me going back to NMP school. I think it increases your nursing reach. It gets you involved in a lot of things. It gets you a great voice in the place you're working to change things through practice changes and QI. I just think it's an awesome opportunity, and I'm super happy we have so many people that are interested in it. And if you have any questions at all about anything, I gave you my email. Feel free to shoot me a message and I'll get back to you as soon as I can. And if I can't answer it, I'll figure out which one of these people can help us.
Yeah. And we have all your contact information, so we'll stay in touch as the programs, approvals, processes goes. We'll let you know once, for example, applications are open, once we have more information, once the website is up. You are really our preliminary people, so you're a very special group, and we appreciate that you took the time to come and hang out with us today and learn about this very important special field, which I don't know if others from the beginning heard, NPs are the #1 field job rankings. So you're in a good place. This is a fantastic opportunity. And yeah, reach out if you have more questions. Thank you.